Lung cancer. Lung cancer is a disease where cells in the lungs grow uncontrollably, forming tumors. It's one of the most common and deadliest cancers worldwide. There are two main types: non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. The primary cause is smoking, but non-smokers can also develop lung cancer due to factors like exposure to secondhand smoke, radon gas, asbestos, and other pollutants. Lung cancer often doesn't cause symptoms until it has spread, making early detection challenging. Symptoms include a persistent cough, coughing up blood, shortness of breath, chest pain, and unexplained weight loss. Treatment options depend on the type and stage of cancer and may include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Understanding lung cancer highlights the importance of preventive measures like quitting smoking and reducing exposure to harmful substances. It also underscores the need for regular checkups and advancements in medical research to improve early detection and treatment outcomes. Click subscribe to this channel to get more topics you love. Breast cancer. Breast cancer occurs when cells in the breast grow abnormally and out of control. It's the most common cancer among women worldwide, though men can also develop it. There are different types of breast cancer, with the most common being ductal carcinoma in situ, CIS, and invasive ductal carcinoma, IDC. Risk factors include genetics, age, family history, hormonal factors, and lifestyle choices. Symptoms of breast cancer can include a lump in the breast, changes in breast shape or size, dimpling of the skin, nipple discharge, and pain. Early detection through regular self-exams, mammograms, and clinical exams is crucial for successful treatment. Treatment options may involve surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy, depending on the cancer's type and stage. Breast cancer awareness emphasizes the importance of regular screenings and lifestyle modifications to reduce risk. It also highlights the strides in medical research that have improved treatment options and survival rates, offering hope to those affected by this disease. Colorectal cancer. Colorectal cancer affects the colon or rectum and is often referred to as bowel cancer. It's one of the leading causes of cancer-related deaths worldwide. The development of colorectal cancer typically begins as a polyp, a small growth in the inner lining of the colon or rectum. While not all polyps become cancerous, some can turn into cancer over time. Risk factors include age, family history, a diet high in red or processed meats, a sedentary lifestyle, obesity, smoking, and heavy alcohol use. Symptoms may include changes in bowel habits, blood in the stool, abdominal pain, unexplained weight loss, and fatigue. Regular screenings, such as colonoscopies, can detect polyps before they become cancerous and catch cancer early when it's most treatable. Understanding colorectal cancer underscores the importance of a healthy diet, regular exercise, and routine screenings. Advancements in treatment, including surgery, radiation therapy, chemotherapy, and targeted therapy, have significantly improved outcomes for many patients. Prostate cancer. Prostate cancer occurs in the prostate, a small gland in men that produces seminal fluid. It's one of the most common cancers in men. Prostate cancer often grows slowly and may not cause significant harm, but some types are aggressive and can spread quickly. Risk factors include age, family history, race, and lifestyle factors such as diet and exercise. Early stages of prostate cancer may not show symptoms, but advanced stages can cause difficulty urinating, blood in urine or semen, erectile dysfunction, and discomfort in the pelvic area. Screening methods include prostate-specific antigen, PSA, tests and digital rectal exams, DRE. Treatment options vary based on the cancer stage and may include active surveillance, surgery, radiation therapy, hormone therapy, chemotherapy, and immunotherapy. Understanding prostate cancer highlights the importance of regular health checkups and informed decision-making regarding screening and treatment. It also emphasizes ongoing research to develop better diagnostic tools and treatments, improving the quality of life and survival rates for those affected. Stomach cancer. Stomach cancer, also known as gastric cancer, starts in the stomach lining and can spread to other parts of the body. It's more common in older adults and has several risk factors, including a diet high in salty and smoked foods, smoking, a family history of the disease, and infection with Helicobacter pylori bacteria. Symptoms may include indigestion, stomach pain, nausea, loss of appetite, and unexplained weight loss, often appearing only in later stages. Early detection is challenging but crucial for successful treatment. Diagnostic methods include endoscopy, where a camera on a flexible tube is inserted into the stomach, and imaging tests like CT scans. Treatment options depend on the cancer's stage and can include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. Understanding stomach cancer emphasizes the importance of dietary choices, regular medical checkups, and awareness of family medical history. Advances in treatment and early detection methods are vital in improving outcomes for those diagnosed with this disease. Liver cancer. Liver cancer originates in the liver, an essential organ for detoxifying the body and producing vital proteins. The most common type is hepatocellular carcinoma, HCC. Risk factors include chronic infection with hepatitis B or C, heavy alcohol use, liver cirrhosis, obesity, and certain genetic conditions. Symptoms can be vague and include weight loss, loss of appetite, upper abdominal pain, nausea, and jaundice, yellowing of the skin and eyes. Early detection is crucial but often difficult because symptoms usually appear in advanced stages. Diagnostic methods include blood tests, imaging tests like ultrasound and CT scans, and liver biopsy. Treatment options vary based on the cancer stage and liver function and can include surgery, liver transplantation, ablation therapies, radiation therapy, chemotherapy, and targeted therapy. Understanding liver cancer underscores the importance of liver health, vaccination against hepatitis, and regular medical monitoring for those at risk. Ongoing research is vital in developing better diagnostic tools and treatments to improve survival rates. Esophageal cancer. Esophageal cancer occurs in the esophagus, the tube that carries food from the throat to the stomach. There are two main types, squamous cell carcinoma and adenocarcinoma. Risk factors include smoking, heavy alcohol use, obesity, chronic acid reflux, GERD, and certain dietary habits. Symptoms often include difficulty swallowing, chest pain, weight loss, and persistent coughing. Early detection is challenging because symptoms usually appear in advanced stages. Diagnostic methods include endoscopy, biopsy, and imaging tests like CT scans. Treatment options depend on the cancer stage and can include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Understanding esophageal cancer highlights the importance of lifestyle choices, managing acid reflux, and regular medical checkups for those at risk. Advances in early detection and treatment methods are essential for improving outcomes and survival rates. Cervical cancer. Cervical cancer develops in the cervix, the lower part of the uterus connecting to the vagina. It's primarily caused by persistent infection with high-risk human papillomavirus, HPV, strains. Risk factors include multiple sexual partners, early sexual activity, smoking, and a weakened immune system. Symptoms may include abnormal vaginal bleeding, pelvic pain, and pain during intercourse. Early detection through regular Pap smears and HPV testing is vital for successful treatment. Vaccination against HPV can significantly reduce the risk of developing cervical cancer. Treatment options depend on the cancer stage and can include surgery, radiation therapy, chemotherapy, and targeted therapy. Understanding cervical cancer emphasizes the importance of HPV vaccination, regular screenings, and safe sexual practices. Ongoing medical research and public health initiatives are crucial in reducing the incidence and improving the survival rates of this preventable cancer. Thyroid cancer. Thyroid cancer arises in the thyroid gland, located at the base of the neck. It regulates metabolism, heart rate, and body temperature. There are several types, including papillary, follicular, medullary, and anaplastic thyroid cancer. Risk factors include exposure to radiation, family history, and certain genetic conditions. Symptoms may include a lump in the neck, difficulty swallowing, hoarseness, and swollen lymph nodes. Early detection is often possible through physical exams and imaging tests like ultrasound. A biopsy can confirm the diagnosis. Treatment options depend on the type and stage of cancer and can include surgery, radioactive iodine therapy, hormone therapy, external radiation therapy, and chemotherapy. Understanding thyroid cancer highlights the importance of regular neck examinations and awareness of family medical history. Advances in diagnostic techniques and treatments have significantly improved outcomes, making thyroid cancer one of the most treatable cancers. Bladder cancer. Bladder cancer starts in the cells of the bladder, the organ that stores urine. The most common type is transitional cell carcinoma, TCC. Risk factors include smoking, exposure to certain chemicals, chronic bladder infections, and a family history of the disease. Symptoms may include blood in the urine, frequent urination, pain during urination, and lower back pain. Early detection is crucial and often possible through urine tests, cystoscopy, procedure to look inside the bladder with a camera, and imaging tests. Treatment options depend on the cancer stage and can include surgery, intravesical therapy, direct treatment into the bladder, chemotherapy, radiation therapy, and immunotherapy. Understanding bladder cancer emphasizes the importance of reducing risk factors like smoking, staying hydrated, and regular medical checkups for early detection. Research advancements continue to improve diagnostic methods and treatments, enhancing survival rates and quality of life for those affected. Pancreatic cancer. Pancreatic cancer starts in the tissues of the pancreas, an organ located behind the stomach that aids in digestion and blood sugar regulation. The most common type is pancreatic ductal adenocarcinoma. Risk factors include smoking, obesity, chronic pancreatitis, diabetes, and a family history of the disease. Symptoms often appear late and include jaundice, yellowing of the skin and eyes, abdominal pain, back pain, weight loss, and digestive problems. Early detection is challenging because symptoms usually appear in advanced stages. Diagnostic methods include imaging tests like CT scans, MRI, endoscopic ultrasound, and biopsies. Treatment options depend on the cancer stage and can include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Understanding pancreatic cancer underscores the importance of managing risk factors and promoting early detection efforts. Research into better screening methods and treatments is crucial, as pancreatic cancer remains one of the deadliest cancers due to its late detection and aggressive nature. Kidney cancer. Kidney cancer, also known as renal cancer, begins in the kidneys, which filter waste from the blood and produce urine. The most common type is renal cell carcinoma, RCC. Risk factors include smoking, obesity, high blood pressure, certain inherited conditions, and a family history of the disease. Symptoms may include blood in the urine, a lump in the abdomen, persistent back or side pain, fatigue, and unexplained weight loss. Early detection is possible through imaging tests like ultrasound, CT scans, and MRI, as well as blood and urine tests. Treatment options depend on the cancer's stage and can include surgery, targeted therapy, immunotherapy, radiation therapy, and chemotherapy. Understanding kidney cancer highlights the importance of regular medical checkups, maintaining a healthy weight, and managing blood pressure. Advances in diagnostic tools and treatments have significantly improved outcomes, offering hope to those diagnosed with this disease. Non-Hodgkin lymphoma. Non-Hodgkin lymphoma, NHL, is a cancer that starts in the lymphatic system, part of the body's immune system. It includes numerous subtypes, the most common being diffuse large B-cell lymphoma, DLBCL, and follicular lymphoma. Risk factors include a weakened immune system, certain infections, such as HIV or Epstein-Barr virus, exposure to certain chemicals, and age. Symptoms can include swollen lymph nodes, fever, night sweats, weight loss, and fatigue. Early detection involves physical exams, blood tests, imaging tests like CT scans, and biopsies of lymph nodes. Treatment options depend on the type and stage of lymphoma and can include chemotherapy, radiation therapy, targeted therapy, immunotherapy, and stem cell transplant. Understanding NHL emphasizes the importance of awareness of symptoms and risk factors, as well as advances in treatment options. Research continues to improve survival rates and quality of life for those affected by this diverse group of cancers. Leukemia. Leukemia is a cancer of the blood-forming tissues, including the bone marrow and the lymphatic system. There are several types, including acute lymphocytic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. Risk factors vary by type but can include genetic predispositions, exposure to certain chemicals, previous cancer treatments, and smoking. Symptoms may include fatigue, frequent infections, easy bruising or bleeding, and bone or joint pain. Early detection often involves blood tests, bone marrow biopsy, and genetic tests. Treatment options depend on the type and stage of leukemia and can include chemotherapy, radiation therapy, targeted therapy, immunotherapy, and stem cell transplant. Understanding leukemia highlights the importance of early detection and advances in genetic research and treatments. These advancements have significantly improved outcomes, particularly for certain types of leukemia that were once considered difficult to treat. Skin cancer, non-melanoma. Non-melanoma includes basal cell carcinoma, BCC, and squamous cell carcinoma, SCC, the most common types of skin cancer. These cancers typically develop in areas exposed to the sun, such as the face, ears, neck, and hands. Risk factors include prolonged sun exposure, fair skin, a history of sunburns, and a weakened immune system. Symptoms can include a new growth or sore that doesn't heal, changes in existing moles or spots, and lesions that bleed or itch. Early detection involves regular skin self-exams and professional skin checks. Treatment options depend on the type and stage of cancer and can include surgical removal, topical treatments, radiation therapy, and photodynamic therapy. Understanding non-melanoma skin cancer underscores the importance of sun protection, regular skin checks, and early treatment. Advances in treatment methods and public awareness campaigns have significantly improved prevention and outcomes for this common cancer. Melanoma. Melanoma is a serious type of skin cancer that develops in melanocytes, the cells that produce melanin, which gives skin its color. It can spread to other parts of the body if not detected early. Risk factors include excessive sun exposure, fair skin, a history of sunburns, family history, and having many moles or atypical moles. Symptoms include changes in existing moles, the appearance of new unusual growths, or changes in color, size, shape, or texture. Early detection is crucial and involves regular skin self-exams and professional skin checks. The ABCDE rule, asymmetry, border, color, diameter, evolving, helps identify suspicious moles. Treatment options depend on the stage of melanoma and can include surgical removal, immunotherapy, targeted therapy, radiation therapy, and chemotherapy. Understanding melanoma emphasizes the critical importance of sun protection, regular skin examinations, and early intervention. Advances in immunotherapy and targeted treatments offer new hope for those diagnosed with advanced melanoma, significantly improving survival rates. Multiple myeloma. Multiple myeloma is a cancer of plasma cells, a type of white blood cell found in bone marrow. It leads to an abnormal production of plasma cells, which can form tumors in the bones and interfere with the production of normal blood cells. Risk factors include older age, a family history of the disease, male gender, African American race, and exposure to certain chemicals or radiation. Symptoms include bone pain, frequent infections, anemia, kidney problems, and fatigue. Early detection can be challenging as symptoms often overlap with other conditions. Diagnostic methods include blood tests, urine tests, imaging tests like X-rays and MRI, and bone marrow biopsy. Treatment options vary based on the stage and can include targeted therapy, chemotherapy, corticosteroids, immunotherapy, stem cell transplant, and radiation therapy. Understanding multiple myeloma highlights the need for awareness of symptoms and risk factors, as well as advances in diagnostic techniques and treatments. Research continues to improve survival rates and quality of life for those affected by this complex cancer. Oral cancer. Oral cancer, also known as mouth cancer, can occur in any part of the mouth or throat. Risk factors include tobacco use, heavy alcohol consumption, human papillomavirus, HPV, infection, excessive sun exposure to the lips, and a family history of cancer. Symptoms can include a sore that doesn't heal, a lump or thickening in the mouth, white or red patches, difficulty chewing or swallowing, and persistent mouth pain. Early detection is crucial and involves regular dental checkups, during which a dentist can perform an oral cancer screening. Treatment options depend on the cancer stage and can include surgery, radiation therapy, chemotherapy, and targeted therapy. Understanding oral cancer emphasizes the importance of avoiding tobacco and excessive alcohol use, protecting lips from sun exposure, and regular dental visits. Advances in treatment and public awareness initiatives are vital in improving outcomes and survival rates. Ovarian cancer. Ovarian cancer begins in the ovaries, the female reproductive organs that produce eggs. It's often detected at a late stage because early symptoms are nonspecific and can include bloating, pelvic pain, difficulty eating, and frequent urination. Risk factors include older age, a family history of ovarian or breast cancer, inherited genetic mutations, such as BRCA1 and BRCA2, and never having been pregnant. Early detection methods include pelvic exams, imaging tests like ultrasound, and blood tests for cancer markers, e.g., CA-125. Treatment options depend on the stage and can include surgery, chemotherapy, targeted therapy, and hormone therapy. Understanding ovarian cancer highlights the importance of awareness of symptoms, family medical history, and genetic testing for those at high risk. Advances in early detection techniques and treatments are crucial for improving survival rates and outcomes. Colorectal cancer. Colorectal cancer starts in the colon or rectum. Risk factors include older age, a diet high in red or processed meats, obesity, smoking, heavy alcohol use, a family history of colorectal cancer, inherited genetic conditions, and a sedentary lifestyle. Symptoms can include changes in bowel habits, blood in the stool, abdominal pain, and unexplained weight loss. Early detection involves screening methods like colonoscopy, fecal occult blood test, FOBT, and imaging tests. Treatment options depend on the stage and can include surgery, radiation therapy, chemotherapy, and targeted therapy. Understanding colorectal cancer emphasizes the importance of regular screening, a healthy diet, and lifestyle changes. Public health initiatives promoting screening and early detection have significantly reduced the incidence and mortality of colorectal cancer.